decisions. And sometimes to pass ordinances and laws in the city level and in the county level. And the instruction that I've always got from our attorneys and from my police chief in Napa City and from the sheriff here is that if an organization, if an authority passes an ordinance or a law or any kind of statement that cannot be enforced, you've actually weakened the integrity of that government authority.
Woo.
And you've also accomplished nothing. And so I am not a doctor. I started out my college career at Northwest Nazarene College back in 1968 as a pre-med major, but I then dropped out of school, went into the Navy for 4 years, and came back as a psychology and music major. So I'm not a medical person, and I'm not going to argue the pros and cons of medical things. But I will say this, that as a public official with authority and law-making, ordinance passing authority, I believe we have to be careful in those laws and ordinances we pass so that we don't weaken the system itself. And I believe we're going down a good track to make strong recommendations and encouragements of people that take this seriously. Mr. Chair, this is a serious health issue in our country. We cannot ignore it or assign it to some sort of conspiracy. It is serious, it's real.
Okay, thank you very much. I agree 100%. One thing that I kind of wish that was on in this discussion was education. After hearing Deputy the other day, I was like, well, maybe we do need to do more education rather than so much bickering about what to do. Education as to what the disease actually is and how it affects different people and different age groups. There's a lot of things that we have learned over a period of time, and we need to disseminate that information and educate folks so that they can make good choices. That's basically the way I look at what comes down. Is there any other questions that you have, commissioners, for either Nikki or her staff?
Yes, I have one, Mr. Chairman. I'm surprised to see this 64 foot. We had a Republican convention in Idaho well over 14 days ago and had almost 600 people there. I don't say that there was very little social distancing, but as far as I know, not one single person has gotten sick from that. But as far as the schools go, our kids are at very low risk, and there are maybe a few that are getting it, but very, very few. And something else I wanted to point out is instead of talking about cases and numbers, we should be just talking about hospitalizations, the length of stays, and the deaths. Only deaths a month, and although that is like total deaths, and that includes probable cases as well, quite a few actually probable cases. So, 64 feet, we're going to run out of real estate. I realize Idaho only has 1.78 million people, but that's the onus that we're putting on our schools, our businesses. I mean, we are dropping in GDP over 4%. So I guess, and it's expected that the United States will drop from number one to number 6 within the next couple of years.
Yikes.
Because of the mandates and the things that we're putting on people all over the country. So I don't know, how many more restrictions we want to consider or put on people. So, and I know
Our restriction is a recommendation. Yes, Commissioner.
Recommended restrictions.
Yes, ma'am.
I can address it.
Yes.
The spacing of one person per 64 square feet is based on the questions that we have received from a lot of public event venue holders. And they are asking for guidance because they want to operate and they want to operate safely for those citizens that they serve that have concerns about their health, and also just be able to continue to do that. So that specific piece is really only for, like, if you're going to have an event at the Indian Creek Plaza, or, a wedding somewhere, or a sporting event. And we've been asked repeatedly, like, how many people can we put in that space? And it had to be very generic. Well, either when there was a limitation set by the governor, we could say, well, you can only fit 50 people in Idaho Center. Well, to me, that doesn't make a lot of sense when it's such a huge venue. So we tried to use a different strategy in approaching that. And if the board doesn't support that, and they have other ideas on how we can help provide good recommendations and guidance to our community to help them hold events in a way that they feel is safe for the patrons, I'm happy to take that into consideration and continue to work on it. That is what we were asked to have been asked for. Again, people seeking their guidance from us based on our expertise, and that is what we've come up with. But again, like I said, we're open to changing that to something different.
I just want to reiterate something you said, Nikki, and that is, this is guidance that people are asking for. It is their personal choice. It's not the district saying, this is what you gotta do. Say, here's what we recommend. And that's exactly what you said, which allows for personal choice. And I think that's the proper thing.
We're a health district. We're here to serve the people, and they look to us for education and guidance and recommendations and information. And we do our best to provide that. So, like I said, if that's something that you feel should be a different recommendation, I would appreciate a different recommendation be given to the district that we could share with the public to address their concerns. And I want to also just mention in terms of case numbers, the reason that's valuable to us is to understand what the denominator is, understanding that we don't know fully the denominator because of testing shortages, and then not everybody needs to be tested. We recognize that too. So, but it helps give us a sense of how the disease is moving through the community over time. And so if you only look at hospitalizations and deaths, you would know, well, how many people were actually sick, and that, or how many people have been exposed. And that helps gives us a sense of the overall picture.
Okay, thank you. Do you have any other questions for Nikki or comments on what's been presented?
I was just gonna say that I'm looking to do the same thing with my extension office, because we plan on continuing to have our fair and our rodeo, but I wanna make sure that we have the information out there for people to make the smart decisions. That's what I'm looking for.
Thank you. Well, Gem County's still having their rodeo also. Yesterday, Commissioner Butici was out marking off 6 feet in the stands. And whether people wish to follow those guidelines, if you really want to know, a lot of that has to do with the liability factor. That we are showing that we are trying to follow the recommendations both by the CDC and the governor. So that, but still try to allow things to happen. There has to be some common sense in all of this. Maybe we've got common sense, maybe we don't, but I think we're trying. But anyway, yes, Tom.
I just want to point out, we were all disappointed in Canyon County when both the Snake River Stampede and Caldwell Night Rodeo canceled their events. But I want to point out and make it very clear that was their decisions as private individuals in charge of mitigating liability both to the participants and to the spectators. That was not a government decision in any way, shape, or form. It was done by the private sector, which is the proper way.
Hey, thank you, sir.
One more comment. Perhaps somebody could enlighten me on the conditions of liability. So these are all.
I don't think anybody knows that yet, Nikki. I know that there has been some cases, and I know that some of the cases have actually been awarded. So I think that at the present time, yesterday there was a large discussion back east, supposedly. There was supposed to be a large discussion, at least it was a small one, in the Senate about trying to limit liability for businesses that open back up. There's a lot of businesses evidently that are concerned to even open up, because if they do and they are sued, I mean, our court system is a little different. People, anyway, there's things that are awarded that baffle my mind, but it does exist, and it has, absolutely, there has been some awards.
Mr. Chairman, that's another concern of mine. If we make more recommendations and people don't follow them, does that make the liability, on private businesses and venues?
Nope.
Okay.
Doesn't change. I don't believe so. It's still their choice at that point.
Mm-hmm.
But that's what we wish to do, is to just make some recommendations with some intelligent backing, with something that, with statistics, with whatever, that gives people the opportunity to look at it and then they make their own choice. They can make a good choice, they can make a bad choice, and time will tell what that is. I can't say what it is. Just the same as we can't say exactly what the numbers are going to be 3 weeks from now. They may go down, they may go up, I don't know. Nobody does. It's all you can do is actually try to predict them, and hopefully, like I said earlier, make sure that people have the ability to be treated if necessary. Okay. Is there anything else, Vicki, that you'd like to add?
Not at this time, thank you.
Okay. Commissioners, anything in particular? If not, then I would stand for a motion for recommendations of 1, 2, and 3 as listed.
Mr. Chair, I think we've had good discussion here. We've had good information disseminated both to the board members, through Southwest City Health. I really want to commend Katrina. She's been very quiet over there. She has taken on the role of public information officer for Southwest District Health, which is a brand new role for her. And she has been a stellar person in taking care of this. So Katrina, thank you really for all you're doing. And folks, treat this lady with respect, and because she deserves it. She really does.
Thank you.
Thank you very much. I know she's been hammered in trying to do her job. So, yes.
Mr. Chair, that being said, I will make the motion that we authorize this health board to issue strong recommendations. I say, it doesn't say strong recommendations, I'll say recommendations to wear face coverings when the alert level is above yellow in public places where physical distancing of at least 6 feet between non-household members is not possible. Number 2, recommendation to limit the density of persons to events to a minimum of 1 per 64 square feet of space when the Southwest District Health Alert is above yellow.
Boo.
3,
Boo.
temporarily suspend visitation to older adult living. Again, this is recommendation, and these people are asking us for recommendations. These are not mandates.
Okay, thank you, Commissioner. I have a motion. Do I have a second? I have a motion and a second. All in favor, please say aye. Aye. Those opposed, nay. Okay, we have 1 nay. And so motion.
Clapping for the one nay.
For the
Clapping
nay.
for the nay.
Okay. So, with that, I am going to adjourn the meeting.
Boo.
Hope you all get voted out.
Wow.
We'll do our best.
And we will. So they adjourned the meeting because we clapped for the nay? Is that what's going on? They're adjourning the meeting because we clapped?
No, it's just the end of the meeting. They already took their opinions.